After hernia surgery, people usually recover pretty quickly. Minimally invasive approaches have allowed us to really decrease that recovery time pretty dramatically. Laparoscopic or robotic inguinal hernias, usually that first week you're pretty sore. But then by the end of the first week, you're probably just a little bit sore enough that you take a little Advil or something in the morning and be okay. People are usually back to work in about a week, and then back to full speed, no restrictions at 2 weeks out from surgery. Now that doesn't mean you're pain-free at 2 weeks out. You're still sore, but that you're not going to hurt anything. So we turn you loose after 2 weeks. Now incisional hernias and midline hernias, we keep you down a little bit longer, and that's because of the different forces that are at play and the increase in recurrence rates in midline hernias. So with midline hernias, depending on the size, people are down for 4 to 6 weeks. Usually I tell them you'll be at home for probably about a week, 4 or 5 days, and then back to work on light duty, not lift anything heavier than a gallon of milk for about a month, and then pretty much back to full speed at about 6 weeks out.